Welcome to our show, Health Shenanigans, Makuhwa, Ehutano. I'm your host, Amanda Matseketsa, a pharmacist. This platform is a platform where we talk about real stories, real challenges, and real struggles that encourage others and breeds awareness. We're talking about issues on public health, concerns that are around our burdens of diseases in our country, Zimbabwe. Today is a very special episode because we're joining in the global conversation about breast cancer. Hence, pink. Think pink. So, we have two brilliant guests today with us on our episode. We have Mr. Taku. He is a real cancer research expert. He also specializes in precision medicine and drug discovery. Welcome, Mr. Taku.
Thank you, Amanda. I'm so glad to be joining you today. I feel happy to be talking about this important subject outside of the lab. Thank you so much.
So glad to have you. We also have a very brilliant colleague of mine. She is an academic and a community pharmacist. Her name is Mrs. Nomelo Mandibatsira. Welcome, Mrs. Nomelo.
Thank you so much, Amanda. I'm glad to be here as we fight breast cancer together.
Awesome. So, we're talking breast cancer. There's so many issues that are surrounding breast cancer. There's fear, there's so many stories, and this platform is here to debunk some very important myths that we hear around our relatives, social media, and some of our friends. So, why is it important to spread breast cancer awareness?
Thank you. I'll take that question. Awareness means early detection. And early detection means saving lives. I'd love to give an example for you, Amanda. Say on a normal day, one day you're working in the studio and somehow a fire catches. When the fire is too small, you can just use a cup of water to take it out. But now, if you get scared and maybe leave the fire to get big, it should be a problem. But somehow, someday, at some time, that fire needs to be extinguished. You understand? So that's like breast cancer. If you leave it go, if you don't attend to it, it gets big, and now it will be hard to deal with. But from the studies that we've done, we've realized and we've learned that amongst, let's say, 90% of people who detect breast cancer early, they are successful in the battle against breast cancer. So it's important to be aware. It's important to be knowing what's happening. Because if you're aware, you're saved.
Oh, that's awesome. Thank you for that.
Thank you.
So we're going to get into a round about myths or facts. So our first myth that we're going to get into today. If no one in my family has breast cancer, I don't need to worry. What do you think about that, guys?
I think I might have to take that on as well with an example.
Yes.
I want you to imagine like family history. There's those lights that come on your dashboard when you're driving to work.
Yes.
You understand?
Yes.
You have to pay attention to those lights because
Yes.
they're important. You get it? That's like the family history. You need to be aware of it. You have to be aware of the family history because it's
Yes.
important. It
Yes.
really is important. But
Absolutely.
now, when you're talking about breast cancer, it's a different issue. It's a different scenario. It's now like when a tire bursts
Yes.
in the road
Yes.
that we've been driving every day. You're walking 1,000 times in that road, but at some point you don't see a light on the dashboard. It's just goes.
I like that analogy.
Yeah. You understand?
Yes.
So now they are random. These are random situations. You don't predict them. You don't see them coming. Sometimes
Yes.
they're just caused by genetic mutations as we
Yes.
age. Sometimes it's caused by the lifestyle that we live in, our day-to-day life. Sometimes it's caused by the environment that we live in.
Yes.
You understand? So now, if you have past history, if you are a member of your family has had cancer or not,
Yeah.
it doesn't give you a ticket that you're going to have cancer. It also doesn't give you a free pass.
Yes.
You understand?
I understand.
So what's important, of course, in our saying, I would say from a professional perspective,
Yes.
90 to 95% of issues of reports that we have of breast cancer, they are not related to family history.
Okay.
So family history, of course, it might play a role, but to a less extent.
Yes.
You understand? So what I would say, it's important to know your body.
Yes.
It's important to be aware, to take care of yourself, to manage your lifestyle, and
Yes.
yeah, of course, pay attention to family history, but pay attention to yourself more.
Okay, that's awesome. Okay, so you hear it for yourself, guys. Screening is for everyone, not just people that have a family history of cancer. Let's move on to our next myth. So, using deodorants or underarm spray causes breast cancer. So people can't smell nice.
Wow. Okay, in Ndebele we call those amahunga ngezempilakahle.
Makuhwa.
Makuhwa Ehutano, the
Okay.
health shenanigans. They are
Yes.
shenanigans.
Yes.
You can always smell nice. You can always, when you look good, you want to smell good.
Yes.
Okay, so the myth around that has
Yes.
been mainly on aluminum compounds.
Okay.
We have people, they want to buy their Nivea rollers, they want to buy their deodorants. The first thing they look for is does it have aluminum? So, okay, aluminum in essence is not related to breast cancer. It might be related to other conditions, but in this case, not to breast cancer. So you can look good, you can smell good. Yes.
So you
Yeah.
hear that, everyone. You can smell good without having to worry about breast cancer.
Yeah.
Let's move on to our third myth. Oh, this is interesting.
I love interesting things. I love interesting stuff.
Yeah.
Okay. So a breast lump always means cancer. You find people feeling lumps, thinking maybe, oh my gosh, I found a lump, this is breast cancer. What do you think about that?
Okay, I heard you from the ghetto, mother.
Yes.
Okay, so imagine this breast cancer
Yes.
or a lump, in fact, like an area, a society in your where you come from.
Yes.
So now a lump is like a new building. Sometimes this building could be a library,
Yes.
a coffee shop, or
Yes.
just a mere bar. You get
Yes.
it. Us as ghetto use that's good. You get it. With regards to breast cancer, we call these benign conditions.
Okay.
They just come, they just go.
Okay,
But now,
what does benign mean? Maybe you can explain that to people.
I wasn't ready for that.
It's not metastatic. It's not.
No.
Okay. Yeah, it's not
Yeah.
spreading in layman terms. It's benign. It's
Yes.
confined.
Yes.
It's confined within a certain tissue, so
Yes.
it's not metastatic.
Okay, it's
in
not
scientific-
metastatic.
Yeah,
Okay.
in scientific
So
terms.
metastatic means it doesn't spread.
Benign.
Benign,
Means
it doesn't spread.
Yeah,
Okay,
metastatic it means it
Oh, it spreads. Yes,
Yeah.
yes. Metastatic means it spreads.
Yeah.
Okay. Yes, you can continue, Mr. Taku.
I'll take you back to the ghetto.
Okay.
So now, with breast cancer now,
Yes.
it comes to a ghetto where like
Mhm.
it happens once in a while.
Mhm.
For instance, a bank comes and open in a ghetto.
Yes.
It never happens. Or maybe for us ghetto youths, the police brings out their best there. You get it?
I get it.
So I would say a lump doesn't really mean breast cancer.
Yes.
You get it? But of course you may not know, and most of the times you may not know. So it's important that if you see something weird, something new, something that you're not
Yes.
according to your body, you
Yes.
should probably visit the hospitals. They've got smart radiation, they have mammograms. That you understand.
I understand.
So I wouldn't say breast cancer doesn't mean like it's a lump. I wouldn't say it's not as well because you never know. So it's just important to be aware of your body and
Okay. I would encourage people not to Google when they feel that a lump.
oh
Yeah,
yeah. Because you
because-
find everything like that.
Exactly.
Yeah.
So don't be scared, guys, when you feel a lump. Go to your nearest clinic where they can screen you and find out exactly what's happening. So let's get into our other myth. Makuhwa zakaya.
Yeah.
Okay, so men don't get breast cancer. Wow. If the men had stopped watching at this point, you need to come back in this video because our experts are gonna break it down for you.
Okay, at this point in time, I would say, oh men, come, sit, relax, and I'll give you coffee. Surprisingly,
Yes.
surprisingly, men have that breast tissue. So we do have, in as much as the percentages are low, in as much as we have a few men that might actually develop breast cancer, but surprisingly, yes, we do have breast cancer in men because of that breast tissue. Yeah. So yeah,
it is rare, but it does happen.
Yeah, it does happen. It does happen.
What do you say about ladies that have small breasts? Because there's also another connotation there. Ladies with small breasts do not get breast cancer compared to the ones with the bigger breasts. I guess it also kind of falls along the men not having breast cancer myth. Okay, so now we now dive into the pathophysiology of it, how it starts. Yes. So we want to know, how does it start? Does it start because you have big breasts, or does it start because you have small breasts? So the issue is breast cancer it's no respect of the size of the breast. So yeah, with those we have small boobs. Oh yeah, you can have breast cancer even if you have small boobs. It is possible. So it's not something to say I'm not gonna get a mammogram because I have small breasts. No, it's not. You just have to go for screening. Okay. Yeah. Alright, thank you. Okay. The last myth that we're going to bust today, a very important one. Breast cancer is a death sentence.
Wow. That honestly is it's a very dangerous myth. Yeah. Because it breeds fear. Yes. It breeds hopelessness. Yes. Yeah, so it's really dangerous. But I want to say, I'm here today to say that it is not true. Yes. It really is not true. Because you remember the way we would say, I would discuss breast cancer when we were younger, probably a decade ago, 2 decades ago. It's different from now. Yes. Recently, you don't even whisper. You don't even whisper about cancer. Yes. Why? It's because of the fights. Yes. It's because of the smart surgeries, the smart radiation, and powerful medicine. For instance, like targeted therapies that we are recently working on. Yes. Those, they will just go out, attack or inhibit some certain tissues and save the whole of your body. And so what I'm trying to say, if you have breast cancer, it's not the end of your life. It of course is a start of a battle, but it's a battle that millions of people have survived. We are not talking about just survival. We're talking about living lives further. We're talking about living like you've never had cancer before. Oh, that is so powerful. Yeah, that is so powerful. Thank you for that. So let's talk prevention. What are some of the risk factors that are there? How can one prevent breast cancer? Okay, the first thing, I call it the first because it will help you detect yourself. Yes. So the first step to prevention is self-awareness. Absolutely. Like he said, you need to be aware of your body. Yes. You need to know how your breasts feel on a daily basis. Okay. So we don't do this monthly, we don't do this yearly, but it's a daily routine. Yes. When you're bathing, you can actually feel that there is something that is coming up. My breasts don't feel like this. Okay, it's actually better for married couples. I should say that, even if you're single, you can actually feel that no, something is not right. Yeah, absolutely. So self-awareness is the first key before we move on to before we go on to mammograms and everything. You need to know your breast. Absolutely. Is it a lump that is coming up? Is it oozing? Is it discharging? Is this normal? Yes. If you're not breastfeeding and then suddenly you see there is a discharge coming out, you're like, no, this discharge was not there before, I'm not breastfeeding, so something is wrong. So self-awareness is of key. Oh, I love that. Well, probably I'll just like add a few from what she said. If you ask me, I wouldn't say prevention is just the first, but I'll say it's the best line of defense. Absolutely. And I'll take it like in 2 phases. Probably first one is like lifestyle choices. Yes. And the second is proactive vigilance. Again, now when you talk about lifestyle choices, like when you need to exercise. Yes. My friends will hate me for saying this, but you also need to limit alcohol. Yes. Yeah, that's not an easy one. Yeah, that's not an easy one. You also need to limit your weight because if like you have fats, they produce estrogen. Yes. And estrogen. Yes. To contribute to that. Yes. Absolutely. you understand. Then at the same time, what she was saying, proactive vigilance, you need to be aware of your body.
Yes.
You need to be knowing that, okay, I'm seeing this change.
Absolutely.
You get it. Then you go see those mammograms, the ultrasounds. They detect these breast cancers like when they're still even far. They are more efficient. And lastly, for probably women who are breastfeeding, it's like a good measure. If you don't want to get breast cancer, feed your baby as much as possible. Let him have milk.
Yeah, awesome.
That's good.
That's good. Thank you so much. So you heard it, guys. I feel pharmacists can also play a very important role. If someone comes in, they're feeling alarmed, please encourage them to go and get screened. Very, very important. So, in our African context, what are some of the barriers that people are facing when it comes to breast cancer, getting screened? Maybe we can talk more about that as well.
Okay, so we have an issue of access. In remote areas, we have people traveling to just go get breast cancer screening, or sometimes to just go get like basic health services.
Yes, that's
so
true.
we have an issue of access, especially in remote areas.
Yes.
So it's an issue to look at, to say, okay, we need some services there, so that people can be aware, so that people can know that I can run to that clinic, I can run to that hospital to get myself checked or to get a mammogram. So in remote areas, that's the biggest challenge.
Oh, that's true. That's very true. Mr. Taku, anything to add on that?
She said everything.
Spot on.
She was spot on. I cannot subtract and not add from what she said. That was really
okay.
Yes.
So awareness is very, very important. I think we can all see that we are having a really serious health burden when it comes to breast cancer, and it's so beautiful that we managed to get this very first episode out during Breast Cancer Awareness Month. Any thoughts as we come to a close from both of you?
Okay, breast cancer is not a curse. Handizvoni madzitateguru akandifambira kuti ndite breast cancer. In as much as that might be true, but we're saying it's not a curse. You can, like what Mr. Taku said, you can still live beyond breast cancer. Even if it's detected, it's not like the end of the road for you. So it's not a curse. You can actually live happily ever after.
Oh, that's good. That's very beautiful. Mr. Taku?
Yeah, she always says everything, but actually, but if I ever get a chance to like say this, to say it's the closing, I love to reach out to my fellow medical scientists out there that our medicines usually that we are recently using, they're designed from the West, from the East China and Europe. We need to put more focus on having precision medicine that's made for our people. Our ladies, even our men, since breast cancer is for both men and ladies, they are different. We need medicines that are precisely designed to help our men. Let's hold our hands, let's come together and fight this breast cancer. Let's bring ideas together. One day we'll have a clean world of cancer.
That's been beautifully said from both of you. So you heard it, guys. Early detection does save lives. Let us encourage our sisters, our mothers, our sister-in-laws, our mother-in-laws, our aunties to go and get screened, because you never know, you could save a life through that. This October, let's just not wear pink. Let us actually spread awareness, help others, support others that are going through breast cancer as a sickness. So I just want to thank the both of you for coming to our first podcasts. Thank you so much for all your thoughts, for all your contributions. I'm sure it has helped the public out there, as this is a platform for spreading awareness and talking about public health. I'm so glad to have you both.
That was a pleasure, Amanda. Please invite me once more.
Thank you so much.
Pleasure, Amanda. Thank you so much for having us.
I just want to thank our sponsor, Harare Institute of Public Health. They've sponsored this first episode. Thank you so much. I just want to thank our production team. And lastly, I want to thank our viewers. Thank you so much for subscribing, liking, sharing, and in the comments, we want to hear what are the issues that you want us to talk about? What are the issues that you want us to discuss that are important in healthcare? Thank you so much, everyone, for tuning in. I'll see you in the next episode from your host, Amanda Matseketsa. Thank you for signing into Health Shenanigans, Makuhwa, Ehutano.
Amahunga ngezempilakahle.
Hunga.